is here for you. Ooh. And now here's your host, Aaron Page.
All interviews presented on the Remedy Revolution podcast are designed to provide information and inspiration only. Guests of the podcast may present opinions and anecdotes which are solely their own. And as always, before beginning any treatment protocol, please consult with your preferred medical provider. Welcome to the Remedy Revolution. My name is Erin, and today's guest is an amazing woman. Her name is Dr. Debbie Ozment. She has been a dentist for, since 1985. She has done a wonderful TED Talk on the Forgotten Orifice, speaking about dental health, mouth bacteria, and all of those kinds of things and how that impacts our health. I'm very excited to have her. You can find her at drdebbiosment.com as well as on Instagram with the same handle, Dr. Debbie Ozment, Ozmet. Dr. Debbie, it is such a pleasure to have you. Thanks for being here.
You're welcome, Erin. Thanks for having me. I've got a weird last name. It's actually Ozment.
Oh, sorry about that.
Oh, that's okay. That's okay. It's odd.
So tell us a little bit. I was watching your TED Talk, and something that really struck me is you spoke about people are living longer. However, they might not be living better. Can you tell us a little bit about that and how that would relate to dental health?
Yes, Erin, thank you. That's such a great question. Well, the lifespan, it actually is starting to decline a little bit since I did the TED Talk, but say it's about 80 years for the average lifespan in the United States, but the average health span is actually much shorter. It's only about 64, 65 years. So that's, the health span is really what we want. That's what you work hard with your patients for, what I work hard for. We want to have this long and energetic life, but I started seeing so many of my dental patients start to take more and more medicine, go to more and more physician visits. They would need to schedule with us, and they'd be like, well, that's my day for my kidney doctor, or that's my day for my, heart doctor. That's my day for my big toe doctor. And it would just be overwhelming. And that's the days, Erin, when I was actually in a regular dental practice. I no longer, do general dentistry, but it was people at younger and younger ages developing these chronic inflammatory diseases. And you know exactly what I'm talking about. I mean, even to the point people in their 20s were having, getting type 2 diabetes, just all these autoimmune problems. So that really changed my perspective.
Yeah, absolutely. So interestingly, I was diagnosed with Lyme disease several years ago. And with that, so prior to that, I had never actually had a cavity and had excellent dental health. However, after my diagnosis with Lyme disease, I wound up getting very severe issues along the gum line. And my philosophy was a lot of that had to do with inflammatory processes in my mouth. And in addition, a lot of these pathogenic types of things that were thriving in my mouth. And so maybe you could speak a little bit to that. Is that something that you've ever seen before?
Absolutely. In fact, I named my TED Talk The Forgotten Orifice because of all this. It sort of propelled me back to school, and I ended up getting a master's in nutritional medicine from a medical school. And so there we had to write lots and lots of case histories, like 27 case histories, and then a thesis. So I actually entitled my thesis The Forgotten Orifice, because even through all of that awesome education, the mouth is sort of, out here separately positioned and not considered much. But we would see it all the time. I just had a fantastic dental hygienist who was very curious and very observant. And so many things, Erin, we could actually send somebody for evaluation based on what we were seeing, because dentistry is unique in that we see people for long period, 30 years for every 3 months or 4 months or whatever. And so you can see those subtle changes, but we absolutely started seeing things change early.
Yeah. So interestingly enough, too, when we met at a conference where we were talking primarily about autoimmune pediatric cases, but specifically about PANS and PANDAS. Interestingly, so I've been in that world for over 10 years, but a lot of parents have noticed, particularly with their children, when they have loose teeth, this phenomenon of an increase in symptomatology. And so, whether or not that is, I don't know. I mean, I've often speculated some of that is pathogenic release. So like strep and all kinds of other pathogens, which might get kind of stuck in those. I don't even know what you call them. I'm sounding very unintellectual here,
No, you're doing great. Kind of in those
but
sockets you're saying where
correct in
yeah.
the sockets. That's the word I was looking for. So bacteria and things start to build up and release. And so we see this increase in symptoms. Obviously, that has been my philosophy. I would defer to you. Is that something, again, that you're seeing? So when we talk about the forgotten orifice, what is it that lives in the mouth? And, how do we start to understand, mitigating symptoms before they start to happen?
Well, these bacteria, good and bad, are in our bodies, and hopefully they're below detectable level. The bad ones are below detectable levels, and that the good ones are thriving. But, it's sort of this battle, I think. And so we have, it's whatever you feed in some form or fashion that is the bacteria that you see the most. So what happened in my practice, I attended a vascular inflammation class that was given by a cardiologist. And in dentistry, that was sort of the first area where we were able to say, oh, what's happening in the mouth is impacting the heart or the circulatory system. Because, we really were just sort of trained as carpenters, as fixing teeth. In fact,
Right.
our daughter, who's now about 32, when she was in kindergarten, they said, what does your mama do? Well, she's a laundry lady and she fixes teeth. And so in that order. So it was so good. But really we were taught to fix teeth. So this conference was just so incredible. And DNA testing, saliva testing, just a simple swish and spit test had been devised, and it tested for 11 different pathogenic bacteria. So these bacteria that were in the mouth, that we were starting to see the DNA of these bacteria in different parts of the body from head to toe. And we're also seeing just the inflammatory component and how that would ignite certain problems. So, Erin, that's probably been almost 15 years ago.
Right.
And since that time, there's just all this plethora of research. We talked off camera about, being a nerd. I totally just love these research articles. Today, I found an amazing research article about pancreatic cancer and a certain bacteria, Fusobacterium nucleatum. That's a bacteria that I'm very, very interested in and research almost every day. So these bacteria, they do several things. Number one, they travel to other areas where they have direct impact. And then also they just create inflammation, like chronic inflammation.
Right.
So even they're in our mouths and we can just sort of forget that they matter so much. And even as dental professionals, we overlook that because we think, oh, your gums bleed a little bit. Well, everybody's gums bleed a little bit, so no problem. Well, it's really a bigger thing than we ever thought of because we can find the DNA in different parts of the body.
Yeah, that's really interesting. So, one of the things that I always found interesting, and I also felt like dentists were kind of on the cutting edge of this whole idea of, bacteria crossing the blood-brain barrier and causing psychiatric symptoms. And that's because there was this strong push, and still is from my understanding, for elderly patients prior to coming into receiving dental work to take an antibiotic. And that was primarily to stave off some of these neuropsychiatric kinds of symptoms that were cropping up after dental procedures. Maybe you could talk a little bit about that.
Well, are you saying that some people would pre-med the...
Right.
Oh, okay.
So yeah, so many of the dentists that I had spoken with prior had said that they would give their elderly patients antibiotics in order to stave off any kind of neuropsychiatric types of symptoms post dental procedure.
Yeah, that's so interesting. I've never actually done it that way, but some other things in the mouth to help to rinse beforehand.
Right.
But they absolutely do impact neuropsychiatric problems. There's one bacteria that we has been studied so widely. I mentioned it in the TED talk. It's called Porphyromonas gingivalis, and
Hmm.
an early study was done, big study in 2012, where they looked at brains post-mortem. And 40% of the brains in people who had suffered from memory loss, Alzheimer's disease, had this oral bacteria, Porphyromonas gingivalis, in their brains. And in the brains of people who died around the same age and didn't have any memory loss, 0% had
Wow.
Porphyromonas gingivalis. So it's one of the many things that contribute, and it's never one thing, as you see in your work. We always want to pin it down to one thing, but it's this whole soup of things that are, this is affecting this, is making this worse, is triggering this. So it's a lot. Now, for years, I've been out of dental school since '85. For years, we've done pre-medication for artificial joints, for leaky heart valves, for all of those things. So it really does matter, because people would get sicker after
Right.
just even getting a simple teeth cleaning.
Right. Yeah, absolutely. So, I know a lot of parents, particularly in my world, are fearful of taking their kids into the dentist, even just for a cleaning. Number one, because they're afraid of the resistance of their child, but number two, because they're afraid it's going to stir up a bunch of different bacteria and create additional symptoms for their children. And I see that a lot in the autism world and the PANS PANDAS world. And, unfortunately, then these kids, sometimes suffer from, not being able to get dental care because it becomes such a traumatic thing, both for the children and for the parents as well. Okay, so let's talk a little bit more about what you are doing now and how do we translate, oral health and, overall general health and well-being. What kinds of things, you've mentioned a couple specific bacterias, but what kinds of things are you recommending for your patients to engage in, either as a habit or, different procedures or supplements, those kinds of things? What kind of things are you recommending?
Well, I look at the oral microbiome, I test it. I use a couple of different tests, but basically we get a good profile of what's showing up there. And then pretty much I test the gut microbiome with a GI map. And that came about, Erin, based on what I was finding orally and being able to put with symptoms. Back in 2019, I actually sold my restorative practice because I was starting to just see so many physician referrals of people mostly with these chronic inflammatory problems like we talked about that are on the rise. And of course, they all have a gut component. So what I had started to learn through all of this is that this bacteria, Fusobacterium nucleatum, has an affinity for moving to the gut. And in the gut, it is actually considered causal for colorectal cancer, irritable bowel, all kinds of problems. And I consistently see high levels in the mouth and levels in the gut that are dangerously high often. Now,
Sure.
it's an interesting bacteria. It's a commensal. So at low levels, it's actually a beneficial bacteria. I call it the mother-in-law bacteria because, at low levels, it's a good bacteria. And I'm a mother-in-law, so I can speak to this. But, if I go in and start moving their stuff around and telling them what to do and I won't leave, then I'm not a good mother-in-law. But Fusobacterium's that way. What it does, it can take up residence in the gut, and there it's a bridge species that causes all kinds of problems. So I'll do my testing. I also do a 3D x-ray, a cone beam x-ray, and that shows us a lot about the mouth. Often I'll see an infected root canal that's absolutely making a mess of things. And that's a situation where those root canals can grow some bad bacteria, some spirochetes and, things that are super dangerous neurologically. So I look at that and then determine, what needs to happen orally. Often people need a really good cleaning, like a deep cleaning. I use a laser, I use ozone, have a whole regimen. And then I help them through sort of wellness coaching get their guts healthy.
Mhm.
And I'm using a lot of fermented foods. It just depends on the person. But as you well know, it's really helping people think of what they want to do in their life, having a good reason to make necessary changes and to just kind of, take a path more toward traditional food and what their body really craves.
Yeah, absolutely. So, on that note, I know, for example, Weston A. Price was a dentist. And so what kinds of things are you seeing that are beneficial beyond, some of the fermented foods? And do you subscribe to some of the Weston A. Price or ideals?
Oh, that's such a great question. Thank you for asking me. Weston A. Price is the dentist that no dentist have ever heard of. We never talked about him in school, but I am fascinated by his work. And I think his book is actually just kind of right here. He traveled throughout the world in the 30s, looking for these traditional people to see how different their health was, how different their mouth was. We were starting to see crooked teeth. We were starting to see airway problems. And so I do subscribe to the Weston A. Price philosophy and of food, as well as just living a more traditional lifestyle. One thing I'm learning, Erin, I office with a biological dentist who's IAOMT certified, and she's awesome. We have so much fun. But we're able to actually measure airways from our 3D x-rays. And because we take wisdom teeth out, that kind of collapses the airway. We take them out, everybody needs their wisdom teeth out. I mean, how many people have I sent for third molar extractions that's just what we did? Not anymore. I see it so differently now. I believe those teeth are there for a reason, and they help hold the airway open. Another thing that's happened is that we don't have foods we have to really chew that much. These high ultra processed foods are basically pre-digested. So people don't have to chew. You don't have to chew these foods. And so if kids are eating a lot of those foods, their muscles don't develop. They don't develop this strong musculature that, this more square face that people need in order to have straight teeth, to have room for their teeth, as well as to maintain that good airway. It's been shocking to learn about Weston A. Price. I mean, we don't have to just have all these cavities and all these braces. I mean, that's not how we're designed.
Yeah, absolutely. So I've had a couple of people come on and speak about Weston A. Price and the importance of, all of these amazing, I kind of tend to call them like grandmother foods. They're like these foods that our grandmothers, knew about, our ancestors knew about, and knew the benefits of them. And unfortunately, we've really strayed so far from some of that, in today's society and in such a major way. So, I mean, a lot of people don't even know where their food comes from.
Right. Oh, Erin, we went to the Weston A. Price, it's Wise Traditions conference
Right.
last year. And so, in fact, on my podcast this week, Sally Fallon Morell's on. She's the one that wrote
Awesome.
Nourishing Traditions. Her book right here. And this is like delicious food. When we talked about butter and raw milk, never in my wildest dreams would I have thought I would be wanting raw milk. Yes, I do now. They're so good at talking about supporting the small farmer, knowing where your food comes from, which makes so much sense. I mean, somebody can be very plant-based and have such a, pure heart wanting to be plant-based. But if their food is laden with pesticides and all these toxicants, then they're really going to be sicker. And so it's super interesting. I would recommend Nourishing Traditions for anybody. It's not just a cookbook. It's actually sort of I can tell you're so familiar with it. It's like I hate to say encyclopedia. That's something you and I would like, but in a good way. It helps you learn about things and more develop your why. It comes back again to, I think life should be delicious, and that way of eating is very delicious. it doesn't leave people hungry. It doesn't leave them with roller coaster blood sugar. It was a fascinating conference. Absolutely.
Yeah, it's so interesting. So I'm a recovering vegan. I actually was a vegan for about 2 years ago, 17, 18 years ago now. But what actually changed my mind about all of that? Now, I was a bleeding heart, animal lover. So that's really what led me down that path initially. And I was kind of, led, in my opinion, astray and, into believing that this was a more healthful way of living. Well, then I got pregnant. And when I was pregnant, I was sitting down to eat in a restaurant and I had this intense craving for red meat. And I had not eaten meat, like I said, in, 2.5, 3 years. And I finally said, you know what? My body is telling me what I need to be eating right now. I need to have those, the iron rich, the B vitamins, all of those amazing things that come with eating red meat. And interestingly, as you mentioned before, red meat is something that you have to chew quite a bit. So, I guess we can segue into that conversation because I'd love to hear a little bit more about this whole idea that, we need to chew our food because of a number of things like, I know it creates more enzymes in the mouth, which then helps with some of the bacteria and all of that. Maybe you could speak a little bit to that.
Oh, that's fantastic. I think that, we're in a hurry all the time. So people really don't chew their food. So when I sit down and do what I call their unravel, I write a personalized report for each person. Typically I'm saying, I want you to sit down to eat, not in a car, if possible. And that's, the goal is 90%. Let's, we can't be perfect. And I don't expect that. It gets too stressful if we try. But to take a few deep breaths, try to get your body into parasympathetic mode, and then to concentrate on chewing every bite and putting your eating utensil down. So, Erin, since I started doing that, I'm the last one finished every time. But it's a way to enjoy your meal more. Because, otherwise I used to devour it and then be like, okay, I'm still hungry. What can I eat? And then you eat, and then I would eat until I was just miserable. So this is such more what I consider to be by design. We're supposed to relax. We're supposed to enjoy our food. And so I tell my patients and clients to osmentize their food, because there was this guy named Horace Fletcher. Have you heard of Horace Fletcher?
I've not heard that name.
He was one of the first food scientists back in the early 1900s, and he would tell people to chew like 90 times. I mean, even liquid. It was, so overboard. But he called it Fletcherizing. And he had a lot of good research around that, because when you're chewing, you're releasing enzymes, things start to break down. So that's easier on, digestion all the way, from stem to stern, if you start it out correctly. And so I tell people, you don't have to chew 90 times, but you do need to chew until each bite is liquefied. And so we'll just call that osmotizing, not Fletcherizing. But it really is important. And Erin, it makes a huge difference for people when they will actually do that. They come back and they're like, Debbie, it's crazy. I don't have acid reflux anymore. I don't have, GERD, but it's really just taking the time to enjoy life is, part of it.
Yeah, absolutely. And, I would suspect many of us live in this very much a fight or flight state, high cortisol levels, adrenal fatigue, burnout, those kinds of things, hormonally, which I would imagine, just sitting down to enjoy a meal, that can be incredibly beneficial for, relaxing, bringing it down the fight or flight, getting more into a parasympathetic state, which will then, I would presume, ease digestion and all of that. So then looking at from the mouth to the gut, what are we talking about with regard to some of the dysfunction? So, I think a lot of people have really normalized and sensationalized things like obesity and, IBS, acid reflux. These things have become, common, in my opinion, but not normal. But I do feel like the conversations around them, say in the mainstream medical field, have become very much normalized. Even things that we consider now to be very mild, like constipation or diarrhea. So maybe you could talk a little bit about that and how all of this relates to each other.
Yes, I totally agree that we have normal has a different meaning than it used to. Normal is not what we want to be. I always say, normal is dehydrated, irritated, frustrated, constipated, overscheduled, overstimulated, on and on. Normal is not where any of your listeners want to be. It's not where any of my listeners want to be. We want to be optimal. And I started asking my dental patients probably about 12 years ago, tell me about your bowel movements. And they would just be like sort of shocked. And they would say, thank you for asking, and so many people would say, well, I haven't pooped in 4 days. I don't poop, it's just like, we don't talk about root cause enough. We treat symptoms and we only look at it in terms of, oh, well, do you need some sort of laxative or do you need some sort of, proton pump inhibitor, but you and I look at root cause. So that's the difference. People have to be their own advocate to look for root cause, because otherwise they will just get their symptoms treated. And while those symptoms are being treated, everything's getting worse. And pretty soon, there's going to be a disaster.
Yeah, absolutely. I think so often, even from infancy all the way to old age, we're talking about things that people have really conditioned themselves to believe are, normal. I had a couple of clients who had children with very severe diarrhea, infants, and I'm talking like 12 poopy diapers a day, and then all the way up to elderly patients with dementia, and they're not going to the bathroom but like once a week or something like that. So there's this very broad spectrum that I think a lot of medical professionals today have been conditioned to believe is normal because they're seeing it as so commonly, right? But that doesn't necessarily mean that it's normal. That's not the way that the body is meant to function. It's just the way that our bodies are functioning as a result of, what we're putting into our bodies, food wise, as well as, all the other lovely things. Okay, let's talk about hygiene, oral hygiene. Now, obviously, there's lots of things out there, lots of whiteners and straighteners and, all kinds of other things. What, in your opinion, is the superior oral hygiene protocol?
Well, Erin, to go back to what you talked about with normal, I think the main thing is for people to know that bleeding gums are a sign of an inflammatory disease. Mm-hmm. And bleeding gums have been normalized because they're so common. Normal is just what's typical in a society at a certain time. And unfortunately, almost everybody has some bleeding gums, but you cannot have optimal health with bleeding gums. It's like a low level wound that's just dragging the immune system. Mm-hmm. So I think when people realize that, it's just an epiphany. It's like, okay, my gums should not bleed. And that's the main thing. I mean, you can put all the whiteners on there, all the fancy toothpaste, but until that biofilm, like there's a calcified biofilm that can live under the gums. That's the condominium complex for where these bacteria live and breed. Until that's cleaned off and daily kept gone, then you're going to be sick. And teeth are the last to go. We talk about teeth, and teeth matter, but actually the physical health suffers long before you really see anything in the teeth. I mean, we want to keep our teeth, but once they are damaged by gum disease, then the physical implications are giant. So I think, as far as root cause, which I so appreciate that that's what you're all about on your podcast. As far as root cause, you've got to find a dentist and a dental hygienist who understand that bleeding matters. It's not good. It's not about, necessarily the carpentry. The first level is for the gum tissue to be healthy. You should not be able to make it bleed. You should be able to poke it and it doesn't bleed. Period. Period. And so a dental office, it's standard of care to measure around each tooth 6 points at least once a year and record those. We learned that in 1981. When I started dental school. It's called a comprehensive periodontal exam, and you want to find an office that takes time to do that accurately and carefully. And it can kind of hurt a little bit if you're inflamed. I use a specialized topical anesthesia for that, called Orkix, that works really well to numb the gums temporarily, not a shot. But so that's number one. Then, of course, systemic, your body's pH affects the teeth greatly. So I think it's great to find an office that maybe checks pH and then helps people can check their pH at home easily for pennies a day. And you want to keep it, you want to have it in the good range. So the pH tapes show that, but you can kind of tell from what you ate the night before. If you ate a more high carb meal, you'll notice that your pH is more acidic, and you kind of know how to measure that, because that's a whole lot of dental health is pH. And then, what gets talked about a lot are, of course, toothpaste and whiteners. And, that's sort of esoteric in terms of health. We want white teeth. We want to have a beautiful smile, but that's not the place to start.
Right, right. So something came up for me, and as you know, having listened to a few episodes anyway, I love giving myself as an example for research, of course. But interestingly, so I mentioned earlier I had quite a bit of decay all along the gum line in my rear molars. And I also had visible cavitations. For those of you listening, cavitations are the sockets that have closed up from oral surgery, from wisdom teeth extraction. And there can be bacteria and other things living in those sockets. And so I did have those cleaned at the time. I had another tooth extracted. I had a lot of dental work. And interestingly enough, I got very, very sick immediately following. Wow. And I went to a wonderful dentist. They're fantastic. They shout out to Transcendental, their holistic dentistry. They use ozone. They even drew blood and, all of those kinds of things. So, ultimately, I think I was in very good hands, but I still got very, very sick following. My Epstein-Barr titers went through the roof. I had new infections that I hadn't had previously, that had never come up on any testing. So I do think there is, we can do all of the prevention and things like that in order to, try and stop any of those things from happening. But in my case, I did actually see a substantial decrease in my health when obviously I was going to get the cavitations and all the decay taken care of, because I wanted to improve my health. Mm-hmm. So what would you say to someone who maybe needs a lot of, specifically a lot of dental work post all of these infections and things like that? What would be the best way to prime the body when you go into those kinds of procedures in order to make sure, or to at least give it your best shot at not falling victim to the kinds of things that I did?
That is an incredible story, and thank you for bringing it up. That's why I think people need a microbiome testing to see exactly what's happening in your immune system, from the oral microbiome to the gut microbiome. Health starts in the gut, and the gut starts in the mouth. So you don't want to go into all that in a weakened state. At that point, Erin, had you been diagnosed with Lyme disease?
Yeah, I had. So I had chronic inflammatory disorders for a long time. I first had Epstein-Barr when I was 18 years old. So it was nothing new, but the decay had happened over the previous, say, 8 to 10 years. So I did have Lyme, as well as a number of other infections. But these were infections, multiple other viruses and bacteria that I had not tested positive for previously, and they came out once I had that cavitation and an oral surgery. So,
Yeah, I think for doctors like you to work with dentists really closely would be the ideal situation because, we don't know what all a biological dentist is going to find opening up those cavitations. That's not the work I do. That's the work that my colleague does. And like she will open up a cavitation and it is just like mushy mucus in there. It's shocking what's holed up. And once it's out and clean, but the body has to deal with it.
right.
So I think it just has to be depending on your level of terrain, the health of your terrain, maybe get that stronger before you actually go into the surgery. And part of that would be for the oral microbiome to be tested because so the way we do things, I clean up the oral microbiome and then she sees them. So I think that's a big part of it, just to increase that oral inflammatory load.
Right, right. Yeah. So you mentioned it earlier, but I know a lot of people speak about airway restriction, mouth breathing, even doing taping of the mouth to prevent nighttime mouth breathing. Things like tongue ties and all of these kinds of things are very prevalent, I think, in today's society, maybe more so. I don't know what the research is on that. Perhaps you could speak to that. But with regard to structural types of things like that, where do we begin? Looking at, say, a pediatric patient or somebody perhaps with severe apnea or something like that. What would you recommend, and where do we start looking at the actual structures?
I am not an expert in this area, but what I'm seeing and the people I refer to have had lots of extra training in this area
Sure.
and they can assess it very objectively. It's really an incredible science. And so they will fabricate very specific mouthpieces, retrain the muscles, especially with little kids. They can give them fun exercises that, they sort of have competition, it's like a game and their muscles respond so quickly. They start sleeping well. So therefore they start doing better in school. Their hyperactivity decreases. But basically, Erin, if I'm answering your question completely, and forgive me if I'm not, because this is not really at all my area. It's a specific mouthpiece or mouthpieces that you exercise your way into, even
Yeah.
for adults. And of course, it takes a lot longer for adults, but it works. I mean, it's amazing. And people, that maybe we thought had narcolepsy, they start staying awake. They're just oxygen hungry.
Yeah, interesting. Yeah, absolutely. I think it's a big conversation within the pediatric, special needs world. A lot of people talking about things like reversing tongue ties and the need to do all of those things. I take a lot of great pause when it comes to any kind of procedure that's going to alter, the physical structure of the body, because ultimately I believe we don't have extra organs. We don't have,
Right. Like
that
the
we
wisdom teeth, like we talked about, they're there for a
right.
reason.
Exactly. I love that you said that too. Had I been, wiser in my younger years, perhaps I wouldn't have had that and then had that whole cascade of things that occurred after my wisdom teeth were removed. But yeah, I mean, I really feel like ultimately, if you can avoid taking organs out or, moving structure, things like that, I do think, that's ultimately the best option on the table. Wonderful. Okay, so what is one thing that you could recommend for our listeners today that might assist them in moving forward? Maybe somebody that's just feeling a little bit stuck with their health. Maybe they're, older and their health is declining. They feel like they've, kind of got some little memory things, glitches here and there, things that they're finding concerning. What is the one thing that you recommend that they could start on today?
Well, this is going to sound very too easy, but it really works. And that is to use like gum picks or toothpicks or something to disrupt the biofilm under their gums. It literally is huge. And I used to do a lot of medical mission trips in Nicaragua, and I would see people that had these beautiful teeth. Most people didn't have beautiful teeth, but pretty much consistently they would make a little chew stick out of, like take a little branch, a little, twig, and just peel it and then scrub their teeth with that. And so I'm sorry I don't have one handy, but these they're called gum picks, or there's all these variations. But the point is you scrub between, and you can be aggressive with these. And that's going to, once your teeth are clean, to remove the biofilm. Now, if you need a deep cleaning, you got to do that. But you have to do your homework to keep it clean. But even say if there's something there, you can really decrease inflammation in that way by keeping that down. That inflammatory load and those pathogens that are in your mouth, travel all over the body, and health starts in the gut, but the gut starts in the mouth. And so by doing that, you can disrupt and really change your immune system via your gut, via just chronic inflammation. Erin, it's giant, and it sounds so easy, and it's literally pennies a day, and it's something pretty much anybody can do. And when they start doing it, somebody sent a picture last night to me, and they're like, I love these things. I'm addicted. And, it just feels good. And so that would be my number one thing.
Yeah, absolutely. One last question before we get to our rapid fire, because I know there's a lot of fear around dentistry and taking care of our mouth. And I know that, I was never fearful of the dentist until I had these major issues.
Yeah.
And then I put off going for a very long time because it was very fear-inducing. The idea, I knew that I needed a lot of work. I knew that there was a lot of things going on in my mouth, but I allowed it to go on for a long time because there was a fear of, pain, a fear of, getting sick like I eventually did. But, also financial fears, it's quite expensive to take care of all of those things. So maybe you could speak a little bit to some of that fear and calm some of the anxieties for anyone listening today who might be feeling that way.
I think start low, go slow. I mean, if you have all these problems, you don't have to take care of everything at once. And I think, that's just good advice for all of us in anything, whether it's behavior change. It's really just start somewhere. And I do see that as a problem when it comes to dentistry. Just too many things are done at once, and it's a big load on the body, and it's a big toxin dump at times. So one thing I would do is just say start low, go slow. You didn't get in that position overnight, probably, and you don't have to get out of that overnight. And then find a dental team who is relational and not transactional. That applies to all areas of healthcare. We are people, and we have emotions, and it matters. And anytime go to a dentist or any other healthcare person, that professional should answer your questions, should tell you if they don't know the answer. They should listen to your questions. You should never be shamed for asking questions. It should be a safe place where you develop a safe relationship. And I think that is in the almost 40 years that I've been in this profession, I've seen that change, and it ought not be so.
Mm-hmm. Absolutely. I think that's fantastic advice. All right, Dr. Debbie, we are on to our rapid fire questions, and I am excited to ask these. So are you ready?
I'm ready.
Okay, perfect. Number one, if you could choose only one natural remedy for the rest of your life, what would it be?
Okay, this is going to sound nutty, but I would choose having a biblical eternal perspective, because I think fear just causes so many people to be sick, and there's enough things we can't change. And just in seeing people so afraid of everything, I think that's really wrecking health a lot. So that's what biblical eternal perspective.
Awesome. I love it. Yeah, fear does cause so much illness. For anybody looking to research that a little bit more, there's a great book called The Body Keeps the Score, which I find fantastic. All right. Tell us something most people don't know about you.
Well, I'm going to skydive for my 65th birthday. I turned 65. So when the weather warms up, probably come to Texas, in fact, down by Austin where it's maybe the Blue Bonnets. But I'm going to skydive. So
awesome. Very adventurous. I have not done that. Done a lot of adventurous things, but not skydiving yet, anyway.
Yet. Yeah, that's right. Yeah.
All right. If I were to compile a playlist of happy music, what song would you suggest be added?
I think I like Jerry Lee Lewis. There's a song he sings called Rave On, and I love that song.
Yeah, awesome. All right. What is your favorite guilty pleasure?
Green chartreuse. Have you heard of green chartreuse?
I have not.
It's a liqueur. It's a liqueur that has like 130 herbs in it, and I think it's from this. There's a story on it, but only 3 monks in the world know the recipe. They all know a third of it, and it's just like a teeny tiny bit of it. It's got this like an herbal tonic, and it's delicious. You sort of just dip your tongue in it, and occasionally that's a real treat.
Awesome. Well, I'll have to come back up to Oklahoma.
Well, no, it's everywhere. When you come, we'll have some for you.
Yeah.
But it's everywhere. It comes from France. And it's been really hard to find. But it's really special. The color green chartreuse is named after this particular array of herbs.
Interesting.
That came before the color was named.
Wow, so interesting. All right, what is the most influential book you've ever read?
It would be the Bible.
Awesome. You are not the first one to say that. All right, what does the word revolution mean to you?
Oh, I love that. I love that word. That was the theme when I did at the TED event where I did my TED talk. It means thinking for yourself. It means exploring. It means not just settling for status quo. The name of your podcast is fantastic, Erin.
Thank you. All right. What does the word remedy mean to you?
Remedy means to get well, not to treat the symptom, but to treat the cause, to look for the cause. I think remedy is often an onion, and with start low, go slow, you have to take these layers off, but you get to true healing. Remedy is beautiful.
Yeah, absolutely. And if you could impart one piece of wisdom onto our listeners, what would that be?
Health starts in the gut, but the gut starts in the mouth. The mouth is not just about teeth and a smile, but very much a part of the microbiome.
Absolutely. I think that's fantastic advice. So everybody, if you are interested in learning more about Dr. Debbie Ozment, you can actually find her TED Talk on YouTube, I believe what is it called? The Forgotten Orifice. She also has a podcast called Vitality Made Simple. And you can find her again at Dr. Debbie Ozment, Ozment, on Instagram or drdebbieozment.com. Thank you so much for being my guest today.
Oh, my pleasure.
It has been such a pleasure.
Thank you, Erin. Appreciate you having me.
All right, y'all. Have a great day. Take care. We'll see you next time.
With hope as a guiding light, through darkest days we'll fight the night. With a whole lot of truth, Remedy Revolution is here for you.